Okay, we're back, and here we have the Purent Bennett or Covidian 980 ventilator. And let me just go through a few things on here so you can kind of get acclimated to it. So on the front here, of course, we got the monitor up there. This one does have an arm, so you can hook up your circuit. Down on the bottom here, you have a couple connections. This one here doesn't tell you that it's to the patient, but if you look at it, the arrow to the lungs, this is where we're going to connect the bacteria filter and the inspiratory limb of that circuit. Down here is, again, this one says from the lung going out. In other words, the exhalation line is going to fit right here. This is an exhalation bacteria filter and water collection. You can open this up. This should be replaced between patients. You lift this up like that, and this door opens. Here's the filter. Lift. Okay. It's a filter, exhalation filter, and also a drain water. But anyways, we just stick it right back in. Put that in, lock it. It locks in like that, okay? So that's the ventilator. The power on this one is underneath this flap here. We'll turn it on here once I connect it. Okay, so I'm going to let this video run while I'm connecting it. Oops, there we go. Got it. Hang on. So let me go ahead and connect everything. I'm going to get the circuit. Just going to put the circuit over there. And as usual, we'll connect the power to the red outlet. Quick connects here to the oxygen, air, and let's go ahead and connect the circuit. Let's see, connect the circuit. I got a bunch of stuff back there. Let's make sure we're still lined up perfect. Okay. So the circuit, the bacteria filter here, take it out of the bag. Again, bacteria filter, this is going to the patient. Stick that there. The vent circuit. And we have the vent circuit here. I'm going to move this arm out a little bit. That way we can just connect the circuit, hook the circuit on that. So again here, remember this is the to the patient inhalation. To the patient, this is where you would connect a temperature probe. Just make sure all your connections are nice and snug, because you could get leaks. Usually there isn't much an issue here is these connections, but the filter, there could be these filters here. I noticed some of them split in the middle, and I think it's a manufacturer defect, but sometimes you want to check on that. But check, make sure that there's all the connections are good. Connect that there. Exhalation, remember, it goes down here. Okay. On the 980, make sure that you have at the Y that it's open, it's not capped off, or you don't have your test lung on there, because this ventilator, it will sense, it actually has a little bit of flow that's going through here, really low. But if it senses that there is an obstruction or some resistance, it'll start the ventilator on. So we need to keep this off, okay? And then here's that temperature probe connection over here. We'd stick temperature probe. I'm going to stick this back on where it was. Okay, that's another place you could get leaks. So I'm going to leave it open, and I'm going to zoom. I'm going to turn it on, and then I'll zoom in on the screen so you can see the screen. This one has a super loud alarm right off the bat. So we're going to, as soon as we can, let's zoom in real tight on this screen here. We're gonna silence it. We're gonna go, we can't silence, but we can lower the volume, which I'll do that, but hang on. So I zoomed in on that for you. Okay, there we go. Give it a few seconds, it'll kick in. It's going through a system initialization. Okay, so right now it's saying, do you want a new patient, same patient, SST? I'm not gonna do the SST, but that's a short system test, which it'll go through all the sensors and everything. This one is working. You can, all the tests you can run, even the pressure, make sure that there's no leak. It'll pressurize the whole system. It'll do a compliance test on the circuit, airway resistance, everything on it. We're not gonna do that because that does take a little time. So I'm gonna put new patient. It's gonna, and it will, down here, there is an alarm button. It's the bell with this alarm, like this sound symbol. I'm going to tap it, and you can see this comes up here. So I'm going to turn it down to, you heard how that is. Pretty loud. You turn it down. Always do that when you first start this ventilator up. Make sure it's still down there. Okay. Okay. So with this one here, where you could put in ideal body weight and all that, but you don't have to. You can go straight from the calculations that you're going to be learning how to calculate ideal body weight. You'll learn how to set up initial ventilator settings depending on their situation and all that. But we'll leave it right there at 50 kilograms for now. And I'm going to go to, well, let's just cancel for now. And I guess we got to get back in there. New patient. Guess we're going to have to select gender, male, female, male. Okay. So we select male with 50 kilograms. It puts default like alarm settings and everything. But on here, on the screen, you can see up in this area, you see all the modes of ventilation. The other ones had their modes, and they're all different location and all that. They have different names and all that. We'll talk about that in lesson 4 and 5 about the naming and all that other stuff. But anyways, it does up on type of ventilation, invasive and non-invasive. You can use this as an NIV, non-invasive ventilator. These aren't cheap. So to use a ventilator, ICU ventilator like this for NIV is really not cost effective, and it's actually wasting money. You should use a NIV, the V60 is usually what's used out there. But anyhow, invasive is what we're using. And you have the mode of ventilation. What type of mode? Is it assist control? Is this synchronized ventilation? Is it spontaneous, bi-level? We're going to be dealing with AC or SIMV. So it's already set up, already defaulted to assist control. And the type of ventilation, are we going to deliver a pressure, or are we going to deliver a volume? Volume is what we're going to be dealing with. Volume VC plus is when you're actually going into the PRVC mode, which is another mode of ventilation we'll talk about later. But we're already in there. And here are the ventilator settings. You have the respiratory rate, you have tidal volume. This one, it says Vmax. Vmax, it says V dot. V dot indicates flow. So that, okay, so we gotta go back in there. We haven't done anything with that. We don't wanna turn it on yet. But anyways, Vmax is flow. Again, that's how fast the air, the flow is going to deliver that tidal volume to the airways. You have a sensitivity. This one has flow V dot sensitivity, This is a trigger. This is, we learned trigger is what cycles on, or I shouldn't say cycles on, but trigger is what starts the inspiration. FiO2, you have a peak flow. This is not peak flow, this is peak pressure limit. This is one of the alarms that already kind of puts it in there. PEEP, and we talked about that decelerating flow pattern or the square pattern. We can do, this one only shows square or decelerating. Again, the decelerating flow pattern is normal. It's actually a little bit more normal breathing than a square, but then we'll deal with that later. On the left here, you have all your alarms. You have apnea alarm. All of them have an apnea alarm. And usually we'll talk about alarms, and they're on this sheet here that tell you where you put apnea delay, 20 seconds, apnea, 20 seconds. And we'll talk about apnea alarms. And then you have regular alarms. They set for peak inspiratory pressure, your respiratory rate, upper and lower limits, minute ventilation, V.E, total minute ventilation, upper and lower limits, tidal volume, mandatory, and they have one for spontaneous. If they're, well, I'm not going to dig too deep into that, but you want to set those upper limits, upper and lower limits, okay? There's one here, VTI, usually that is not set. We don't need to deal with that one. Then they have more settings, and just saying leak, sink, O2 sensor humidification, or we use HME. Generally, that's how we set it up here in the lab, and most of the time it's HME in the hospital initially. And then when we're ready, we're going to click start. We'll connect the test lung to that, and it'll begin to start the ventilation at what we set. I'm going to go back to the vent. These are all the parameters that were set. Okay. Once we get into the screen, we can look at that later, maybe do another video. We can access different waveforms and different loops, so we can learn about that as well. But that's the 980, and that's setting up the vent circuit on the 980.